Much, Right Honourable Speaker. I thank the committee for their report. And Right Honourable Speaker, I want to entirely agree with you. We must prioritize the purchase of the PET machine so that we end the challenge that Ugandans face. There is actually wrong diagnosis going on in this country. By the time they discover that somebody has cancer, this person has reached stage 3, stage 4, Right Honourable Speaker. So 62 billion gap, we must find this money because what is available is 30 billion. What they need is 92 billion. Let us put aside everything for the sake of ensuring that there is a proper diagnosis. And of course, we have been told that the cancer patients annually, they receive 7,000, and those are those that are diagnosed. But there are people who have cancer out there and they even don't know. So, Right Honourable Speaker, the second issue, can we focus instead of doing so many things at the same time? Cancer Institute already has a regional center fully constructed and commissioned in Omoro, another one in Mbarara. What they need, Right Honourable Speaker, is 15, there is a gap of 15 billion, 15.9. What has been provided is 9 billion. Can we prioritize that? Because what goes on at the Cancer Institute, colleagues, if you get there, you actually feel sorry. It is terrible. It shouldn't be a center of excellence for the treatment of oncology and training of oncologists in the East African region. So, Right Honourable Speaker, I want to support the committee report that let's prioritize. For the Heart Institute, Right Honourable Speaker, they just want to start constructing. Can we focus on the Naguru facility and have it operational first before we think of starting other centers outside? Because for the others, they're already running, like Cancer Institute, I talked about the two. For the Heart Institute, can we first prioritize that and have it operational before we think of the Hoima and another center that they are thinking about? Right Honourable Speaker, I want to move to the other. The digital X-ray machines. Thank you, Minister of Health, for procuring these equipment. Right Honourable Speaker, we've had a challenge of X-rays in this country. When I was Minister of State for Health, we took a new digital X-ray machine to Tororo. Unfortunately, 5 years down the road, this equipment has never worked. Just a small...
Thank you, Honourable Taylor, followed by Honourable Mutawe.
Thank you, Right Honourable Speaker. And thank you, Chairperson of the committee, for your able submission. Right Honourable Speaker, I join my colleagues in applauding government for its efforts to operationalize the regional cancer centers. Right Honourable Speaker, what is pertaining in the Cancer Institute is terrible. And the only way we can decongest it is to make these regional centers operational. And there are certain facilities that we should also start considering in putting in some of our hospitals at the district level, especially in cancer scanning, because most people, by the time they realize they have a cancer problem, it's too late. So we should have a mechanism where information can be disseminated at the local level to enable them. Maybe those who require to go for further screening can be referred. But when at least at the district hospital, we have mechanism to detect. Secondly, Right Honourable Speaker, the 77 billion funding gap for the health center for health in constituencies which are lacking should be given priority, in my honest opinion. Some of us represent constituencies which are by the banks of the rivers and lakes. And there is a lot of activity that relates to health in these areas. And the people have a general bias of moving from those areas to go and seek medical attention. So we get a lot of challenges that relate to health in those areas. If these facilities are near to them, there can be an easy way of convincing them to get this diagnosis and then get medical support. Thirdly, Right Honourable Speaker, the issue of ambulances. I don't know which criteria was used in the start on those ones which were distributed, but we need to have a uniform approach. If we say that we are allocating money, then let's have all the constituencies covered in one go. Than saying those who speak well and those who speak less should be given an opportunity and priority. That is not helping us, and we are getting a challenge in this area. Lastly, Right Honourable Speaker, these issues tend to be so sentimental, but the presence of the Minister of Finance would speak so much to the priority given to these issues at this time, and none of them is here. I find it out of proper procedure. I thank you, Right Honourable Speaker.
Thank you. Yeah, I totally agree with you, Honourable, because Minister of Finance has how many ministers, but it seems when Honourable MPsS is not around, no one else can be. You know, it's a pity. And the budget is their process. It's their process. Yes, I had picked Honourable Namtawe, Joan, Honourable Zake, Karangara. I pick Bukomansimbi, Honourable Ibuaru, then Honourable Santa.
Thank you, Right Honourable Speaker. Right Honourable Speaker, I appreciate the funds allocated to national medical stores to procure drugs for our hospitals. Right Honourable Speaker, last week but one, I was in Masaka Regional Referral Hospital with a patient, but the situation I found there is so alarming. Patients are asked to buy drugs from private pharmacies, which is too costly to them. Right Honourable Speaker, Masaka Regional Referral Hospital is struggling with the drug stockouts due to high number of people getting services from this hospital. Right Honourable Speaker, we are in the budgeting process. Can we get a commitment from the Minister that in this coming financial year, all hospitals, especially Masaka Regional Referral Hospital, will get enough drugs to save our people? Thank you, Right Honourable Speaker, for the opportunity.
Thank you. Honourable Zake.
Thank you, Right Honourable Speaker. Right Honourable Speaker, I'll begin from the same note. What everybody keeps talking about in our communities is about the lack of drugs in the hospitals. But my problem is about the issue in the statement that we've just had. There is always money budgeted to provide for drugs in these hospitals, generally, nationally. But in Mitiana Hospital, I've never received any report. All the calls I get from my voters, the people get to that hospital, nobody receives drugs that are for free. First and foremost, money is always solicited from all the patients, almost all patients. On a monthly basis, I actually spend more than 10 million to provide money to buy drugs. Using my mobile clinic in Mitiana, I almost spend a lot of money purchasing drugs, treating people, and I'm wondering what is the health sector doing about this? This is what everybody talks about year by year. And when we get into campaigns, you keep promising free medical services. But this is not happening. So since we have this opportunity that we're in the budget process, let us put up mechanisms to make sure that medicine is not stolen from hospitals and medicine can be accessed by patients. Because almost everybody has cheats from doctors. You can't buy this kind of medicine, buy this so-and-so medicine. So this practice should stop, and we make sure that medicine gets to the common people. I thank you.
Thank you. Karangara.
Thank you, Mr. Speaker, for the opportunity. The people of Kalangala are proud of you. I want to commend I want to commend the committee for such a wonderful report, especially to the hard-to-reach areas. We feel represented very well. The Honorable Chair, thank you for listening to our cry, especially, Mr. Speaker, the issue of ambulances that were not fueled. They were not given fuel in the ND4, but now that you have brought it out, we are grateful and we are hopeful that this fuel is going to come to us, not only in words, Mr. Speaker, but in action. On page, Mr. Speaker, on 29th March 2025, I wanted to give you why we are saying we are happy that we are going to get fuel. There is a lady who was coming from Banda Island. She was going to give birth, but she gave birth in the middle of the lake and in a very ugly boat. So when we have these ambulances functional and very well fueled, we are going to be happy and honored to get them. Mr. Speaker, secondly, on page 21, you gave a recommendation that the committee recommends that the ministry should allocate specific time and days when the boat ambulances should move so that the public is aware of the schedule. Mr. Speaker, a health condition cannot be allocated time. You cannot tell somebody to get sick tomorrow. So why, I don't agree with the committee on this recommendation, because say for example in the islands, you cannot tell somebody to get sick and the ambulance moves or doesn't move. The ambulance must be stationed somewhere ready to move at any time. Yeah? Because if, for example, somebody gets COVID-19 and they have the signs, you mean you're going to wait for Sunday and it is a Monday? So I believe, or I think, Mr. Speaker, this recommendation should be removed from the committee report because it doesn't really make sense for me as a member of parliament from the hard-to-reach areas. I thank you so much, Mr. Speaker.
Thank you. I don't mind about that recommendation because it's not of a budgetary nature. Okay? So the recommendations which we refer to the committee as per Rule 149(2) of our rules of procedure are those that need reconciliation, harmonization, and consolidation into the budget. So since it's not of a budgetary nature, can as well be
Much
ignored.
obliged, Mr. Speaker.
Thank you, Honorable. Yes.
Thank you, Right Honorable Speaker and Chair for the committee for the reports. But my concern from the report, financing and upgrading lower health facilities. We have a challenge. It's a good proposal, but the challenge is we try as members of parliament like me. We have a health center too, Chabagoma Health Center. We have one room. Everything is done there. I took an initiative to even buy the land for the hospital, but the ministry, we wrote letters. We haven't received any response, but it accommodates like 5,000 people, patients. So we need to look into that. Secondly, when we look at upgrading, we even have sub-counties with no health centers in Bukomansimbi, like Butenga Rural. Yet we passed here that each sub-county has to have a health center. So we have to look at sub-counties with no health centers. Lastly, Honorable Speaker and Chair, if we are upgrading, let us focus on some factors like the population. We have Butenga Health Center 4. It helps people from like 4 districts in Greater Masaka. And we all have one regional referral hospital, that is Masaka. If we are to upgrade, we pray, and we have been here praying. Let us upgrade Butenga Health Center 4 to a hospital. Thank you so much.
Thank you. Honorable Santa, Honorable Atkins, Honorable Ongisto, Honorable Ebuaru, Honorable Barimozo.
Thank you so much. Right Honorable Speaker, I thank the committee for giving us a very good report. My first question is to the Minister of Health. You called us sometimes back to Nakasero to receive ambulances. When will Yam district gets the pledge of the ambulance? People are asking day in, day night. Secondly, Right Honorable Speaker, I want to address myself to the issue of the counterfeit funding arising from President Trump's executive order. Mr. Speaker, this has affected HIV, where we have very many people suffering from this. It has affected malaria, where we have children, women, and others, and also TB. And the committee has recommended 9.6 billion, Mr. Speaker. I think when you look at our population and the people affected from these diseases, I think this parliament can find room and provide for this money. Then thirdly, Right Honorable Speaker, I want to add my voice on the issue of the cancer in this country. We recommended that the PET machine must be bought. Mr. Speaker, once again, I want to state that the whole of last year, I was in the Cancer Institute with my late dad, and the congestion there, Mr. Speaker. We are now in the rainy season. When it's raining, you find the attendants out, they are being beaten by rain. And, Mr. Speaker, if there's something that this parliament can do once again, let's buy this machine, number one, then two, let's try to focus on decongesting the Cancer Institute in Mulago by providing money for Mbara Satellite Center and then the Northern Regional Center. And, Mr. Speaker, looking at the Cancer Institute, from congestion to drugs, lack of inadequate staff, you find that we have a big problem as far as this disease is concerned. Then finally, I want to talk about the maintenance of equipment. We have bought equipment in many regional referral hospitals, but we don't have the technicians to maintain them and to service them. So it looks like moving 2 steps in front and then moving another 2 steps backward, Mr. Speaker, because money has been spent, but the equipment works for like 2 months, 5 months or 1 year, and they are down. And then they remain there. Then when the patients come, they are referred to the private facilities. Mr. Speaker, I want to thank you, and I pray this parliament find room to accommodate the budget, more especially for the Cancer Institute in Mulago. I want to thank you.
Thank you. Now, honorable colleagues, as we debate, I think the public should know when we say the committee has recommended, some of this money is not yet provided, so that they don't go out and say, but Parliament, okay? Because on health alone, the unfunded priorities which Dr. Young and team have brought come to a total of 1.776 trillion. That's outside the budget we have. The money we are saying, look for. Okay? That happens to also other sectors. So that's why when we go to reconciliation with the budget committee, it's very critical. A very good example, the health centers, when we repurpose the budget, the health centers which they promised to include, I hope, Chair, they've included them. Ambulances, including my constituency, honorable colleagues, by the way, when you are talking about who is connected. Some of you, most of you are not connected as me, but I wasn't considered for the ambulance. So I join you in the quarrel, we quarrel together. So you have another here. Yes, you have another here. So it's a health center for ambulances. Oh, I don't have. And you look at my constituency, a hard to reach area. Yeah. Thank you. Yes. So I had already mentioned the Honorable Watkins here next, followed by Honorable Manuel Rongso. Then I'll come to independence. Independence, I've noted you. Oh, Honorable Waru was first. Okay, Honorable Waru, then Honorable Watkins. The problem, you keep shifting. You are here, now you're this side.
Mr. Speaker, this parliament, in its wisdom, in April 2021, passed a resolution to honor the doctors in Soroti Referral Hospital following that miraculous operation that they conducted in Soroti Hospital to separate the conjoined twins. Mr. Speaker, at that time, Parliament made a resolution to honor that hospital by elevating it into a into a regional referral and a teaching hospital. The challenge we were given at that time as leaders was to identify land. Our leaders have identified land in Soroti University to a tune of 50 acres of land. Mr. Speaker, sir, as I speak to you now, Soroti Referral Hospital doesn't have a medical ward. A ward that was built by the Whites long time ago has collapsed. Soroti Referral Hospital, as I speak to you, Mr. Speaker, doesn't have an X-ray machine. Soroti Hospital doesn't have an anesthetist. Soroti Hospital doesn't have an orthopedic doctor. Mr. Speaker, Soroti Hospital doesn't have even an oxygen plant.
So what does it have?
I can tell you it has nothing. Now, I raised the matter, Mr. Speaker. These are the things that are on the ground. I am happy Mr. Honorable Minister Chwer is here, whose patients are treated from there. Honorable Kasa is here, whose relatives are treated from there. I raised the matter of a transformer to be put in Soroti Hospital so that we produce oxygen. Honorable Kasai has not attended to me up to now. Mr. Speaker, sir, I want to request that the issue of Soroti Referral Hospital is a big matter. The hospital is by name. The hospitals are sick. In fact, Soroti Hospital is sicker than all the hospitals in the country. I request you, Right Honourable Speaker, and the members, the people who are here, let us take this matter as a very serious matter. Our people are dying. This is a referral hospital. So why would we call it a referral hospital, yet we don't have even Panadol in the hospital? The minister is looking at me. Please listen to me and attend to this matter. I thank you, Right Honourable Speaker. Let this matter, let's look for resources so that we invest in the hospital. We have got land. What is important is only to identify resources so that we build the regional referral hospital and a teaching hospital in that area. Otherwise, Mr. Speaker, sir, information, sir.
Right Honourable Speaker, just to supplement, I know my colleagues here. The truth is, while I'm here, I'm not supposed to really so much make, but Soroti Regional Referral Hospital is sick. There is a need for me and my colleague and all of us and the committee to go to Soroti and look at Soroti and prescribe a solution. It's bad for the people, it's bad for the government.
Honorable Chair, if I may ask, have you brought that to the attention of Cabinet?
There is so much that goes on in the Cabinet that we discuss, but I am telling you, Soroti Regional Hospital is sick.
Yeah, because you see, Cabinet complained that we interfere with the budget. Okay? You are lucky to sit in Cabinet. So I hope the way you've stated it here is the way you stated it in Cabinet, though I know in Cabinet they are called secrets. Honorable Kasai,